broadcast.
When you're live, I'm just going to pull it. I'm going to share it onto my Facebook.
Okay, I'm going to go. I'm live. We're live now, and I am now going to. I think I'm going to go live on Facebook. Go live.
Hi, Judy. Judith, nice to see you. I'm going to pop out the questions.
All right, we are live on Facebook as well.
Done and done.
Hello, everybody. Thank you for coming. We're gonna give it a few more minutes for people to join, and then we will get started.
How are you, Doug? You can have nice casual conversations. I'm just chilling.
Yeah, no, absolutely. I'm just listening to my daughter whine.
Oh, I'm not right now, which is very nice.
And I am sure that at some point during this webinar, one of the two of my kids will come and get in the way in the best way possible. In the best way possible. We'll get started in just a minute now. 1 minute. Dara's giving the 1 minute sign, everyone. All right, why don't we go ahead and get started. I want to first thank everybody for coming. And for those that don't know me, I am Doug Schneider. I live in Park Slope, Brooklyn, and I am running for City Council in the 39th Council District here in Brooklyn. But most importantly, I am a community activist, and I am a father of 2 young kids. And, like people all around the world, COVID has turned my life upside down. Instead of running my law practice, I stay home and supervise remote learning with my first grader, which is not a job I ever expected to have. Instead of spending time with, with my friends and family, sometimes I'm on 3 or 4 Zooms a day. And, my wife and I couldn't even go out to celebrate our 15th wedding anniversary because we didn't think it was appropriate to find somebody to outside of our immediate network, to babysit the kids. And, like so many others, like so many of you, we've done everything that's been asked of us. We wear our masks, we socially distance, we avoid travel and unnecessary gatherings. And yet it's frustrating to see that COVID is again on the rise, and the positive test rate here in New York City is rapidly increasing. And now we are heading into a holiday season where people already have COVID fatigue, and they want to travel, they want to celebrate, they want to be with their friends and their families. And that's why I felt it was important to invite Dr. Dara Kass here today to talk about how to stay safe and how to keep the spread of COVID down as we head into the season. Dr. Kass is an emergency medical physician and associate professor of emergency medicine at Columbia University Medical Center. She is a friend and she is a Park Sloper. She herself was on the front lines fighting COVID from the very beginning. And she got herself contracted COVID-19 while treating patients in the hospital. And since then has become one of the leading voices about how to stay safe and how to fight the spread of COVID. So you may have seen her on PBS or C-SPAN or MSNBC or Yahoo News or you name it, she's been on it. But back here in Brooklyn, she has been advising local schools about how to safely open, including my daughter's own preschool. And right before her school opened, Dr. Kass held an informal session with parents and the school community to talk about what school opening would look like and why it's safe and how to keep it safe. And I will say that Dr. Kass spoke with such clarity and with such authority and really gave parents and teachers confidence that the school had a plan to open safely and stay safe, which in fact is exactly what happened. So the weather is turning cold. We're outside less and less. And this is why it's more important than ever to hear from an expert like Dr. Kass about how to stay safe and do the right things to stop the spread. So after we hear from Dr. Kass, I will ask some questions. We'll have a little conversation, and then we'll turn it over to the audience for some questions. You can use the Q&A function here on Zoom, or if you're watching on Facebook Live on either my personal page or my city council candidacy page, you can put your question in the chat and somebody will be monitoring it. With that, I turn it over to you, Dr. Kass. Thank you so much for being here.
Thanks, Doug. I just wanted to open with the idea that I'm really tired. I think that we're all really tired. And I think that to continue to have these conversations about new decisions we've had to make and information that's still coming at us, it's time to kind of like take a breath and reframe all the information we have to assimilate and what we have to do right now. It's part of the reason I'm sitting on a couch right now, as opposed to at a desk, because I want this to be comfortable and casual and informative. Because at this point in the pandemic, and I can talk a little bit about how we got here, but we've been doing this for 10 months almost. And I did get sick with the virus very early on. So I had a very quick crash course in what this virus meant for me, what it meant for my family, what it meant for my community, and for my patients. And then through the summer, I think we in New York got a reprieve because we worked so hard at getting it under control. And it was so rewarding to see the work of New Yorkers really pay off. And the way I kind of describe this is that there's been like a torrential storm around us in New York for the entire summer going into the fall, and our dam has broken. And now what we have done so well in New York isn't working because there's some fatigue of New Yorkers, but most of it's just the fact that there's an overwhelming spread of this virus across the country. And we could only do so much for so long. And we don't have a new administration and we don't have more funding for our state government. So we have to start thinking about what can we do for the next 12 weeks to stay alive, to protect our citizens, to keep our families safe, to make decisions that are the right ones as we continue to get exposed. And, where I am a COVID concierge, I say, for the community, where I get so many calls a day, I'm averaging somewhere between 10 and 20 scenarios that I'm presented with every single day of exposures and quarantine questions and testing questions and school questions. And so I was actually really excited about this opportunity to answer a lot of them broadly, but really inform everyone about how I make decisions. So hopefully people can start being able to feel good about making those decisions over the next 12 weeks themselves. As we head into February and March, things are going to get brighter. Not just the weather is going to get better, but we're going to have the vaccine start being disseminated. We're going to be on the other side of this hill, but we have the winter ahead of us. And I really want to make sure everyone feels good about the information they have, that we clarify some misconceptions, that we empower people to make decisions, and that we all feel like we can get through this together, because that's the only way out of this.
Thank you. Thank you so much, Dr. Kass.
You can stay on, all the faces you were making, you could comment, casual.
I have a lot to say, as always, but this is your expertise. And so I want to start out with a tweet that you made before Thanksgiving, because I think as we head into the holiday season and as people think about whether or not they want to travel, whether or not they spend time with friends and family, I think that people think that, I'll go get tested and then that will clear me to safely travel. So what I want to do is I'm going to hopefully share your tweet.
Good job.
DC. All right. So this is a tweet that you made right before Thanksgiving, and I would love for you to kind of walk us through what it is that you're saying here and why it's so important.
Okay. So I think that there's a lot of things to talk about with testing, and we all put it into context. But really, one of the things I want people to understand is testing is a tool for information, but it's actually the counseling that comes along with the testing that's the most important thing, because the goal of testing is, yes, to inform those that have the virus, but a lot of times they're symptomatic. So it's like not the same. It's confirming, but it's not identifying. But it's also to inform you about who you need to inform about quarantining, isolation, and it should change the spread. We want to contain the spread of this virus. So we saw before Thanksgiving all over New York City, because we were not all testing for symptomatic surveillance. We saw a lot of people testing to figure out if they could travel. And one of the things I think people needed to understand was what to do with that information. Because like I said, testing is a tool, but without context, it's not relevant. And especially since there's those two kinds of testing, the PCR and the antigen, and we'll talk about them in a second. I wanted people to know how to interpret the information they were getting when they were seeking it out for not the way it was created. So no testing modality, whether PCR or antigen testing, which is basically the one that goes to the lab versus the one that's done really quickly, was studied for asymptomatic surveillance, meaning I want to clear myself to travel. So neither of those tests has been validated to say, yes, you're clear to travel, or no, you're not clear to travel. And that's really important because we saw an overwhelming number of people use it that way, which is not great, right? So we needed to teach people what to do with that information. And one of the things I kept saying was, if you go get tested, as we're seeing an increased number of cases, if you're positive, that's going to change your travel. Right? It's going to say to you, don't go. You're either an asymptomatic carrier, whether or not you're contagious or not is a different story. Or you have a false positive, but it's not worth taking the risk. Or you're symptomatic and positive, in which case we really need to take care of you. But it's the positive test that changes your practice. Many people that were going to travel tried to get a negative test to give themselves permission to travel. And that's not appropriate. If you were deciding to travel for whatever reason, you should still take the same precautions when you get there as you would if you never tested in the first place. In other words, presume you're always contagious when you are engaging with other people, because just because you test negative today, you could be positive tomorrow. And so, short of testing at the door of Thanksgiving dinner with the highest quality PCR absolute test, which proves that you're definitely negative, which is not reasonable, right? Nobody has a lab at the door of their Thanksgiving dinner. There are no guarantees. And so are you also incorporating those public safety measures of masking when you're, in close spaces with people you don't know, making sure that you're not eating in congregate areas with people that are not in your immediate family, and understanding, and this is, I think, the thing that we needed to really acknowledge was, if we're going to have Thanksgiving dinner or any other dinner, because now Thanksgiving is over and we're going into the holidays, if you're going to congregate, and I kind of use gatherings in two words, congregating and transacting. Okay. So if you're congregating with somebody unmasked, usually eating or drinking for an extended period of time, relatively casually, realize that that's an exposure. Whatever. And that means that you could find out 5 days from now, 10 days from now, you could find out 5 days from now that you were exposed and you need to quarantine, and there's a risk that you could get the virus. And if you congregated with one group one day and the next group another day, then you may have actually inadvertently spread it from one group to another. And so the tweet really was about the idea that there are no promises, and that a negative test never gives you a free pass, ever. Even in sporting events, these are all risks we're taking. You can choose to take those risks, but the only test that changes your practice of whatever you're going to do is the one that pulls you out of the game, not the one that keeps you in it.
So let me ask you this. One of the things that I know people are doing if they want to travel and see family is that they are quarantining for 10 days, 14 days prior to leaving.
Mm-hmm.
And then they're leaving and they feel comfortable in the interaction. Is that a advisable thing to do? Is that a safe thing to do? And if not, if somebody is absolutely insistent that they have to travel, or they have something that comes up in their life that they have to travel, what are the proper things to do to decrease the chances of spreading it yourself as much as possible?
So, right. So I think that that's exactly the point, is that if you're going to travel, we can give you practices that are safer. The safest thing is to not travel. So we need to just acknowledge that. So if you don't have to travel, please don't. If you do have to travel for a predicted period of time, so you're going to travel in 2 weeks, and if it's because you want to go on vacation, accept that risk. But I still hold that we just have muscle through this. We can do it, but I'm not going to tell everyone what to do. Doing a 2-week isolation quarantine where you really don't see anybody but the people you're traveling with, that nuclear family, and then everyone tests negative right before you leave, clears you for that 2-week period. Once you start traveling, though, you kind of open up that exposure again, short of getting in your own car and never stopping, getting to your destination where you literally see nobody else. Again, and then they say testing 4 days into your destination, just making sure that there was no exposure over the travel. That's all advisable, meaning that a quarantine period, testing when you get to your destination, but it is not perfect. And I have had consultations with people who have quarantined and tested, been negative, then traveled, then 5 days into their trip, tested again to figure out if they were positive, and found that they were positive. And the entire group that they met on their journey of traveling now had to be quarantined themselves. So again, it's not to say it isn't better, because it is better, right? One of the reasons I want people to feel empowered about is more testing is better. So I want people to test if you're going to travel, right? If you are gonna, and the other part is if you had unexpected travel. So let's say that you find out that your mom is in the hospital in another state and you really want to go and see her because you understand there's a risk to travel, but it's your mother. And I get that. then if you could test before you leave and test when you get there, that would be, it's at least more information, you know? But the safest thing is to minimize your exposures, especially now where we can't guarantee anywhere is safe. There's no state
How,
opinion. Go ahead.
oh, I was just going to say, whether for travel or not, how often should people be getting tested?
So that's a good question. We don't have good recommendations yet on surveillance testing, which is what you're talking about. A lot of schools are doing weekly testing, which I think is great because it doesn't capture everything. You're going to find people through the cracks, but you're going to get most of those asymptomatic carriers and you're going to be able to pull them out of the system. If you were testing your family, like as a surveillance model, because you were curious and you wanted to make sure you captured anyone that was asymptomatic, really every 2 weeks is probably enough. I would say, that would be as frequently as you needed to because of the 2 week, incubation period. But again, surveillance testing hasn't been proven. So there's not a real recommended, like getting a PCR test, which is the deep nasal that goes to the lab every 2 weeks is a way to just feel better about you missing an asymptomatic period. But it's not a replacement for smart public health measures.
Um, changing topic a little bit. What did you do for Thanksgiving this year? How did you celebrate?
So we were home. I lost the battle with my mother-in-law, so she came over and sat further in the house. But I will be completely honest, I don't want anyone on TMZ to be like, I saw her entering the house. But we did cook in our house, and it was 8 people. And so we really canceled everything else. What I did say to my family was Thanksgiving was the last straw. And so I made an explicit statement that given the numbers in New York and given the unexpected rise, especially for our parents, I said goodbye to my own parents 2 weeks before that at my daughter's bat mitzvah. I said that this was the last time I was going to see them. And I told them that I would see them on the other side because I don't want to be the one that brings, I won't probably because I've had it, but I didn't want to find out that my kids brought it to my dad.
Yeah.
So it's a hard decision. It's a hard conversation to have, especially when we postponed my mom's 75th birthday.
People, we're going to all have to make sacrifices, for the common good. And, most of the people in my life are willing to do that. We had Thanksgiving, just the 4 of us and, Zoomed with my family. And that's how COVID started for us. We had a Zoom Passover Seder.
Really?
And so, we are all doing the right thing, yet you read the newspaper, you turn on the TV, and you're reading about people with in the public eye who are gleefully disobeying, COVID precautions. They're gleefully disobeying, Governor Cuomo's restrictions on public gathering. And so, for example, here in Staten Island, we had Councilman Joe Borelli, who lives in an orange zone, who advertised that he was going to have and then had 11 maskless people in his home for Thanksgiving. So my question is, what do you expect from public officials, and how important is it, and how can we model good behavior?
So I think that's actually, you can use my own personal family example, but that actually is a different example. So our family wasn't flagrantly disavowing. We were taking a joint risk together that we knew the consequences of, if that makes any sense. And more importantly, my mother-in-law knew the risks she was taking by coming into the family, and we were very cautious even taking that. What the congressman or the Borelli, yeah, he was like, it was an affront to his soul that he should have to be asked to have a smaller Thanksgiving. And he was all over Twitter on this, right? And what was so upsetting about it was he politicized a public health metric that was to protect all the people in his circle. Because I remember that it wasn't just that he had 11 people or 12 people, they were from multiple families, right?
Yeah, 4 different families.
And they were like, you're not going to take away our holiday. And I think about what we've done over the past year, from Passover to bat mitzvahs, and how we've reframed our own personal family events as an example. Using our bat mitzvah, for example, and the temple that we both go to, we had a Zoom bat mitzvah. Everyone saw us having masks in the temple. And in fact, I was very convinced that everyone that came to the Bima with my daughter had to stay masked because I didn't want to take the risk because they don't live in the same family, right? So even in the sanctuary, which was way under the number, it was important, since everyone could see it on Facebook Live and on Zoom, that we wore masks to model that behavior for everyone that wasn't even in our inner circle, right? And I think that that's something that a lot of people in our community have taken very seriously, is to be part of the solution, and to be, what do you gain by laughing in the face of public health? What exactly are you trying to prove? Are you proving that you're better than this? Are you proving that you're immortal to the virus, or that you don't care that your mom gets sick? Like, I don't know what the goal is, because collectively our goal should be to keep everyone as healthy as possible. And it doesn't seem like a big lift to modify your personal behavior for the greater good of your community, especially on Staten Island, where they're seeing an overwhelming number of patients head into their hospital system. They have a limited number of hospitals on Staten Island. They have a limited number of ICU beds. It isn't really smart of them to continue to try to spread the virus. And unfortunately, this was what he was doing. And so I felt that I thought it was offensive as a human. And I tweeted back to him very clearly, actually, about this when he did this, because I thought, like, how tough are you? Like, what are you proving is what I don't get. Like, what's your point? Make it. But it's not that the virus isn't going to get you, because it's going to get you.
And I don't understand why people think that, you gain celebrity from mocking acting in the common good. Because really that's what we're talking about. We're talking about, like, just the basic idea of protecting your neighbor, protecting your family from death, from at best sickness, and we've seen case in case, people going to weddings and not following the proper precautions, and 24 people from that wedding dying, and it just doesn't make sense to me that we are all taking these efforts, and it takes all of us to stop the spread. And the reason why we're not seeing we're seeing the spread continue in certain areas is that it doesn't work unless we all do it. And every single person who refuses to follow the public health precautions, the CDC guidelines, and basic common sense is responsible for some part of the spread. And the converse is every person who wears a mask slows the spread.
And keep going with these, because I want to give people real tools to use. And there are a lot of things to think about. And remember that every decision isn't the only decision you make. So you can continue to mitigate spread. Like I said, even when we decided to have my parents, my mother-in-law, at Thanksgiving, we still continued to add in measures like making sure we didn't share plates, making sure that we had the windows open, making sure that they sat on a different side of the table, making sure that we didn't, stay near each other inside. So, and also the fact is that my in-laws don't really go anywhere. And so they were pretty well quarantined before this. But the point is that you can continue to make choices if you're in a car with somebody to make sure you have masks on. If you're eating outdoors with somebody, make sure that you sit apart. It's not going to take the risk away entirely. But if we continue to make those choices, the way I describe it is like we're basically in the middle of a wildfire. And the small group gatherings are basically like the embers at the base. And they continue to carry the fire. And every so often you'll see a large gathering that's like a tree, and that will catch fire and spread it further. But it's those embers that burn constantly, that every single time you are unmasked inside with 3 other people, that's a continued ember. And that just keeps the virus going. And our goal is to kind of damp out those embers. And eventually, as we get the vaccine in, those big trees will start to fall as well.
So you mentioned outdoor dining, and our restaurants, as everybody knows, are really struggling. And when the weather was warm, outdoor dining was they were crucial for these businesses and our local restaurants that we love to stay open. And as the weather turns colder, I'm starting to see restaurants building basically these structures that are closed off on 2 or 3 sides with 1 or 2 openings, And my question is, in terms of the virus mitigation and spread, is this really outdoor dining? How safe is it? And should we be doing it, or something different?
So again, I think that if you're eating in those outdoor tables with your nuclear family, then you're still pretty much okay, only because you're not increased. It's that nuclear table that's the highest risk, right? So it's not about if you're going to go to one of those indoor outdoor cabanas, I've been calling them. You really want to do that only with your nuclear family, but they're not. There, there are ones that are safer. They're more open. It's getting really cold. I mean, we can only fight this for so long. What I've been telling people is order in, like go to the restaurant, order out, tip generously, and bring it to your own house where you can sit there comfortably warm and unmasked. I don't really see the utility in fighting for outdoor dining through the dead of winter in New York City. This is like a concept we would never have believed last year. But I do support the idea of keeping our restaurants open. I think it's the fact that we've had terrible federal stimulus. Our federal government has completely failed in every respect in supporting anybody for this virus. And that very much includes the restaurant communities, the bar community, a lot of the concierge services that have really been hurt hard. And so I think we're seeing them stay open longer than they should, because at some point, we're looking for the best answer for what we have. But I would say if you want to support your local restaurant, order in frequently, stop cooking for a while. It's totally safe to bring it in, tip generously, and take it back to your house.
So I appreciate that. And you just brought up a real hot button issue, certainly in my community. You're a parent of public school children. I'm a parent of public school children, and our restaurants and bars are open, and our schools are closed. And so I would like to hear from you. I've got a number of questions about this. I'll lay them out, and you can either not answer any of them and go off on your own, or answer which ones you want in any order you want. But the first is the general question of what do you say, or what do you think? What do you tell a parent about the fact that schools are closed while restaurants are open? What is the research showing about what children are contributing to the spread? What about the fact that schools are closed, but kids are still participating in schools, and after school programs are still running when schools are closed? And I guess also, how can we prevent our children from being part of a school spread? So lots of different questions for you.
And it's not that complicated. So schools are actually really safe. And we know that. And this is one of the times where if we had a better federal infrastructure for data mining, we would be able to have better guidance from the CDC about exactly how many kids could be in a classroom, exactly what would be the best mitigation measures, exactly how often should we be testing children. We'd have federal support for testing children in schools. We'd have a joint partnership with HHS and the Department of Education. None of that is happening. So we have to make it up on our own. And we know that schools are safe. The New York City school system, obviously, what happened with the closures, the 3%, was a function of the negotiations with the union, and it's a much bigger issue that seems to be resolving. And I don't actually see the school systems closing again, short of the entire city getting on back to a shelter-in-place order. I think that once we open on Monday, we're going to stay open, because I think that we're coming at it from a different perspective. More increased testing, better support, better teacher buy-in. I think it's great. On the difference between why are restaurants open versus the schools, obviously we know those are two different decision trees, but more importantly, I think that we're really hitting into a crisis of confidence, not in the leadership, but actually in the mitigation measures. I think that we're dealing with a city right now that is exhausted and has done this once really, really well, and is not following the same level of vigilance again. And I personally think the reason that we have not seen the restaurants, and I do think the restaurants should be closed for indoor dining, but I also think people should be taking out. But I think the reason we're not seeing a lot of new like regressions for the openings and closings has to do with the fact that there is a stalemate right now between what the citizens will accept and what the government can enforce. And I think one of the things that's difficult is putting on measures that people are not going to follow, and then deciding, well, what happens if people don't follow your enforcement? Like if people aren't buying into it. And so I think we're seeing a pivot towards people deciding what they're going to do in their community and doing it together. And so you'll see less people eating indoors in Park Slope because we have collectively decided that we know it's not safe to eat indoors. Whereas on Staten Island, you'll see people get arrested for giving away food and bringing people indoors, even though they're in the orange zone. So I think there's a lot of factors that are super complicated. And I think the best practices we can do here in our community is to teach people what is safe right now, what isn't safe right now. So schools are safe. And as long as they're open, I think our children should go. Masks work. And I think that they're safe for teachers and they're safe for children. I think that testing is important and surveillance testing in schools is critically important because it shows us when the virus is so prevalent that we can't guarantee that like it would overwhelm our ability to keep people distanced and masked. But I think other than that, we should be staying home, which means no more after school programs if you can afford it or avoid it. No more team sports if you can afford it or avoid it. Obviously, everyone has to make different decisions about their family based on their financial circumstances, their childcare circumstances, and their work circumstances. So we want to empower people to feel good about the decisions they have to make. But ultimately, my children go to school and come home and everything else is canceled.
So as we get into the winter, and it's interesting because all the surface cleaning and the disinfecting in our schools, but we're getting into winter, we're getting into, sore throat season, runny nose season. What are the best practices to follow to kind of distinguish between just the regular old kids get sniffles, versus, is this COVID? What should parents be doing if their kids get sick, and how can we make sure that kids aren't, missing out on school because of a false concern about COVID?
So I actually think that's where testing is really important. I think that if your child is symptomatic and you can get them tested, a negative test rules out COVID in the short term. If they're still symptomatic, they should stay home because we shouldn't send kids with upper respiratory infections to school anyway. And especially now that most people are working from home or certainly have flexible employment, it's a little easier to stay home when your kids are sniffly regardless. But I would say that you don't have to worry about, if you have somebody that's symptomatic, you should get them tested. I had a concern that kids were not going to allow for testing frequently, but now we see with the antigen swabs, which are the more shallow nasal swabs, they're a lot easier. I basically convince kids to pick their own nose, is how I say it. And so I say, can you use this to pick your nose? And they go in there, they swab up, they go in the other one, they swab up, they do it themselves, and they generally don't push back. So I think that we're getting better at the modalities for testing for kids. Grown-ups are a little bit harder because, it's the same thing, right? You feel unwell, you should get tested. It's negative. You can believe it if you're symptomatic. If you're not symptomatic and you're exposed, then we start getting into how grownups aren't behaving so well. So they find out somebody they know had it. They don't really want to stay home. And so we're seeing the evolution of the CDC guidelines for exposure. And we'll talk about that in a second. But I think for school and for kids, if kids are symptomatic with any infectious disease, they should stay home for the day, get them tested if you can. If it's negative and their symptoms resolve, they can go back. It's likely you don't see a lot of false negatives when kids are symptomatic.
Thank you so much. I'm going to ask one more question, and then going to take some questions from the audience. A lot of news lately about vaccines, and vaccines going to be around the corner, and so I would love to hear from you. What the latest is on when vaccines are coming, when will they be readily available, when can we start see the mitigation effect, are they safe to take, should we take them, and then finally, well, I'll let you answer those and then I'll ask my last one.
So the two vaccines that are ready to be approved, hopefully December 10th, are both mRNA vaccines. Not really worth going into the nitty gritty of how they work, but basically they don't give you the virus. They give you the gene, the coding that gives the protein that exposes your immune system, that gives you an antibody response that gets you to fight the virus. You never get the virus in your system. They do, the immune response kind of makes you feel pretty terrible. So what they say is that the first dose feels the second dose feels worse. The most important thing to know about these mRNA vaccines, aside from the fact that they are difficult operationally to deliver, they have to have this cold storage, is that you need 2 shots. So once the government figures out how to deliver the vaccine, and we don't need to talk about that as much, although that's going to be a really big deal, it'll be a lot easier in New York than it will be in rural America. We'll probably see large scale vaccine distribution centers, either in hospitals or convention centers, where they have these big freezers that they defrost these pallets of vaccine, and we have appointments where groups come in and get vaccinated in campaigns. The most important thing for people to understand is that so it seems safe and effective. We haven't seen the primary data yet, but when it goes through the FDA and that approval is published, we will get the primary data with that. Because our FDA, unlike UK's FDA, or their vaccine surveillance program, they don't look at the primary data. They look at aggregate data. Our FDA looks at the primary data, which is why it takes longer. People are asking, why does the UK approve and we haven't? It has to do with how deep our system is for approval. So you should feel confident that once we approve it through our FDA, now that the political thumb is off the scale, which we've seen, we can know that because it didn't happen before Election Day. We have a new administration coming in. So we can believe it's safe and effective when we see that primary data and it's approved. And the vaccine science part of it isn't dangerous for people. Then we have to remember that we have to get 2 vaccines to be fully vaccinated to get to the data point that they proved. That means that everyone that goes in for that first shot needs to have a plan for that second shot. And they need to understand that if it doesn't feel good after the first shot, you still need to go in for that second shot. And the other thing I want people to understand is we know based on the data is that roughly, and we're like, this is me and my squad making up the numbers so people understand because we haven't seen this publicly, about 140 people need to be vaccinated to prevent one more case of COVID. But if you think about it at like a 2% death rate, because we're seeing so much death, we're talking about 8,000 to 9,000 people need to be vaccinated to save a life.
Wow.
Now, if you think about Park Slope and how many people live here, we as a community could save 12 lives, if we all go get vaccinated. That's what I want people to understand.
So, the plot of the movie I Am Legend is they think they have the vaccine for cancer, and 6 months later, they're all flesh-eating zombies. That's not going to happen to us, Dara.
It does not seem that is scientifically possible, although 2020 taught me to never think a movie is more absurd than real life.
But in all seriousness, just the last question about vaccines. From what I understand, the vaccines that are being approved now are only to be administered to adults, and that there is no vaccine that's in prep or anywhere near for children. So what about kids, and how effective can vaccination be if it's only for adults right now?
So remember that the most vulnerable are older adults, and so it's going to be very, very effective in preventing people from dying. Secondary is that the vaccine process has to start with consentable and less vulnerable humans, and that means that there are populations, pregnant people, prisoners, children who cannot be tested right away. So the process requires children not to be tested right away. We've already started to see, I'm almost positive it's the Johnson & Johnson vaccine has started to get tested on children. And so we're going to start to see that come down. In fact, there was a 16-year-old in the Pfizer study. And so that they're trying to see if they can start extrapolating that down. What I would say is that the approval process for children will go quicker, but we probably won't see the vaccine start getting delivered to children until probably late spring and summer. But again, since children are masked and home a lot, they're not the ones that we're seeing primarily spread the virus anymore, now that we're kind of keeping their activities centralized or like local. And so I think that we can solve a huge aspect of this pandemic and its spread, and more importantly, protect the vulnerable as we vaccinate the adults aggressively.
So on that note, I'm going to turn and take some questions that we've received, from the audience. And our friend Judith Leaf asks, in public health, you catch more flies with honey. What's the best and most effective way to address somebody that we see not wearing a mask in public?
So it's really hard people that are choosing to not wear a mask right now are making an active choice, and they know, especially in New York City, that they are bucking both public health mandate and the trend. So what I would say is it's almost impossible to get somebody to wear a mask who's not wearing one at this time. And so where I would probably not actually engage them so much. The campaign around masks is that it's reversible, it's easy, it is non-invasive, and it helps protect other people. But the other part about masks, and I think people don't understand this, is if you get exposed to the virus and you're wearing a mask, you not just have a better chance of not getting it, but even if you get it, you have a less severe form. So the mask actually has been shown to not just prevent you from spreading it, but you getting sick because you get less respiratory droplets into your airway. And so they've shown that you get a less severe form of the disease. So what I would say, the only thing I would probably say is somebody who's not wearing a mask for whatever oxygen theory or pneumonia theory, there's a lot of theories out there, is they should know that if they get exposed, they will have a less severe form of the disease just by wearing a mask for themselves. They may not want to do it for somebody else, but they may want to do it for themselves, and that's okay too.
Um, another question that we've actually received from a number of people. Your for school, your kids are doing some semblance of a pod, right?
My third grader is doing a pod on the days he's not in public school.
Right. And so my kids are also doing the pod, and we've gotten a lot of questions about with the spread that we're seeing. How safe is it to be doing these pods, and what should we be doing to make them as safe as possible?
So our pod has the same rules as school, which means that our pod wears masks. We have a HEPA filter in the area that they have. So it's a pretty formal pod in that way. The kids eat unmasked in one direction and don't speak when they eat. And otherwise they're masked the entire time. So my personal opinion is the way we organize and run this pod is as safe as school. If kids were in a pod that were unmasked, which I know a lot are because they're younger kids and whatever, and they're in somebody's house or even smaller, that is something that I would reevaluate as I was trying to mitigate mixing of families. Realizing that if you find out that the parent of somebody in your non-masked pod is positive, you now have a reasonable guarantee that that has potentially spread to your family. So what I would say is if you have a pod of 4-year-olds or 5-year-olds and they have been unmasked before, maybe you start masking them up to keep them together. But it's the time to add in those layers of protection, even in the pods. But if your pod is just like school, which means, so we can't, where do you want to have, so somebody said, why don't you have them eat outside? Because there's no table for them and it's cold. A lot of these kids, so they eat inside in one direction because we don't have a good table. And a lot of schools have been eating outside, but as it gets colder and colder, they eat quickly and they eat deliberately. So they don't talk, and they put music on, so they don't actually speak over it. But these are all things you can do. But I would add in masks. If my pod was unmasked, this would be the time to add back masks.
And if you're looking in the chat, we just got a question that you and I actually talked about a little earlier today, which is, this person's grandparents are in their 70s and 80s. They tested positive for already having the antibodies in the summer. And what does that mean for family gatherings? Is it still, knowing that they already have the antibodies, is it still a terrible idea to have them over indoor gathering, with people who won't be wearing masks? Or, is it, what's the ramification of the fact that they already have the antibodies?
So from first person narrative, right? I had the virus, I have antibodies. I check my antibodies every single month, mostly as a science experiment, but so far it's okay. And I still have the antibodies. Having that said, I still wear a mask whenever I'm with people that are not in my nuclear family. And we have not proven that even if you have antibodies, you can't carry it. Scientifically, it doesn't make any sense. So ideally, we would know, if we had better science and better information, that people that have had the virus have antibodies would not be at risk to be carriers. We don't have that information definitively yet. What I would say is if if you have had the virus and you have documented antibodies, which isn't the same as having the virus and not having antibodies. But if you currently have documented antibodies, it is very unlikely that you can be a carrier to somebody else. So you can feel confident that you are a low risk, but I would still use the same public health measures as everyone else because there are no guarantees. And more importantly, it's not worth just pushing. So I would just say, still wear a mask, stay distance, and stay with your nuclear family as best as you can. If there's an emergency, you can be on the front lines taking care of the person that's sick.
We just got another question in along similar lines, and this is a really interesting one. This person shares a brownstone with their parents, two separate apartments, but with a common entryway and stairway. And the husband is a healthcare worker, and they have 3 school-aged kids, and they have only seen their parents indoors with masks.
Mm-hmm.
And she says it's a daily stress for her about whether or not that's enough to be safe, or if they should not be seeing them indoors at all, even though they're in a brownstone, with a common walkway, even though they're separate apartments.
Okay, so I would say this is when you can lean on science to not feel like you're going crazy, which means transactional, right? Going up and down the stairs, not a big deal. If you're going to congregate, like sit with your parents, please wear masks. That's it. If you do that, you should really be okay because we know masks work. We know that there have been studies anecdotally, hairdressers face to face with the hairdresser being symptomatic and positive, the customer not being positive, there's been no transmission. When you have a healthcare worker in your family, it's a huge amount of anxiety about the idea of somebody constantly being an asymptomatic spreader. And so it adds a real element of anxiety, especially when you have elderly parents. And I say this really from first person experience. So what I would say is stay as safe as you can, but wearing masks inside should be enough. And so you shouldn't have to worry more. But if you start feeling nervous about it, maybe you take a break. Because the most important thing is to not go crazy. It has been a marathon. We're almost at a full year of doing this. Like, that's crazy. And we're probably at 6 more months of like small actions that we still need to take to keep each other safe. So we've got to get through the next 3 months of terribleness and the next 3 months after that aren't going to be so bad, but you got to make it there. And so whatever you can do now to stay sane, go for it.
So I'm gonna give you an opportunity now either to really disappoint people or make people very, very happy. Let's say that you live in Brooklyn, you have siblings that live in Brooklyn, parents live in Brooklyn, so nobody has to travel.
Mm-hmm.
Okay, but if you add up the parents, the siblings, the grandkids, it's 13 people. Is there any way that you can safely and confidently celebrate with that many people, even if people don't need to travel? What would your recommendation be?
I live in Brooklyn. My sister lives in New Jersey, which might as well be Brooklyn. My parents live in New Jersey, which might as well be Brooklyn. And we have taken a pause from family gatherings from now. The way I said it is kind of February 15th is the number I'm putting out. And the reason is that we need a full month of the new administration to really give the funding to the states, to give resources, because that's what we're missing. It's hard. And this is the hard part. My kids are best friends with their cousins. They are the same age. I am so lucky to have a family that loves each other so very much. And we're taking a pause because my dad is 75 and I'm not interested in finding out that my kids who go to school, who see their friends after school for 10 minutes at the hall, are somehow going to bring it asymptomatically. It's just not worth it. We're so close. I mean, I guess that's my point. I want everyone to understand. We are so close to the end of this. The vaccine is here. We just have to have it distributed. We need a better federal leadership to get it to us. But it's not every infection we have after this is a tragedy.
That is a perfect place to start to wrap up. I want to just very quickly. There was a question. You talked about the need to stay home. I think there are people that want to know, like, what are the safe activities that you can do outside? Can you go, walk around the park? Can you take your kids and play in the long meadow? What can we do so that we don't go crazy inside all the time?
So we do a lot of car trips to an outside destination, like even in the city. we'll like drive to a corner, get out, walk around, like we'll go to the Oculus, or well, not the Oculus, the Edge thing that's on the west side, or we'll go to Brooklyn Bridge Park, and we'll just kind of get from our car to some outdoor destination, walk around, be outside, play around, come back. I think outdoors are really important. I think going places is really important. It just gets really, really hard when you start going indoors or other places. I wouldn't go to museums. I wouldn't go, obviously, to any hotels. I just think that it's just, I would just pause on all that for the period of time. But I do think that you need to still have a destination. You need to go do things. You need to see sights. Even if you get in your car, put the windows down and drive around and see new buildings or new neighborhoods. It's a great way to explore. Even if I think car services are safe. I think people have asked us a lot. You know, what if I don't have a car? Can I use an Uber? The practices of the car services have been very good. So if for some reason you want to do that and have them drive you to a destination, I think that's fine. Public transportation has been fine too. So I don't want to disparage that. I think it's been great. But what I would say is any activity outside is great. Have a mask on, and you want to be moving. As long as you keep moving, you're good. It's when you sit and stay for a while that it gets a little dicey.
So I will allow you to make any last comments that you have, and I will ask if people have things come up and people have questions that are complicated or that they want, they need answers to. What are the best ways to get COVID related answers to complicated questions, or even just questions about how to do things safely?
You mean as opposed to 20 DMs I get through Twitter and Facebook every single day?
I was going to say, if you want to give people your phone number.
Oh, I should totally start a concierge service. Give me a nickel, I'll give you some advice. No, look, the truth is that the best way to do this, I would say, is to find some sort of trusted advisor in your life. I hope that it's a doctor. The CDC is going to have better information as we get into the new administration. There's going to be better guidelines out there. It is really hard. I will leave you with the clean decisions that you need to make. So if you find out you're positive, you have to isolate for 10 days. That's just true. If you find out somebody you know is positive, right now the CDC says you have to quarantine for 7 days. And at the end of 7 days, you can be tested out and be negative. You can get an antigen test or a PCR test. I don't have time to go into both of them, but know that whatever you can get, you can get. Right now, testing is covered by insurance. I don't know what's going to happen with the next funding, the next stimulus bill, but all I can say is this. Everybody has it in their power to stop the spread of this virus. So if you find out you're exposed, please do less. Wear a mask, stay home, don't engage with anyone else. If you find out you're positive, please isolate from other people. Beyond that, stay the course. We can do this. We are so close to the end. The vaccine is coming. Get vaccinated when it's your chance, and start to think about what you're going to do on the other end of this. Christmas 2021, Hanukkah 2021, New Year's 2022, whatever it's going to be, find it, hold on to it, and we're going to get there.
Thank you so much, Dr. Dara Kass. As I predicted at the outset, you provide such vital information in such an easy way to absorb, and just have this ability to provide us information to keep calm and carry on. And so I want to thank you for coming. I want to thank everybody else who joined us today. I want to wish everybody happy holidays, mostly just to drive Donald Trump crazy, because you're not allowed to say happy holidays anymore. And again, Doug Schneider, running for city council. You can find my website, dougschneiderbk.com, on Twitter @DougSchneiderBK. If you're not following Dara Kass on Twitter, you certainly should. That's @Dara Kass, right? @Dara Kass.
No, it is.
Yeah. And on Facebook, Doug Schneider. And I want to thank everybody. I want to thank you, Dr. Kass, and everybody. Stay safe, stay sane, and stay healthy. Bye, everyone.
Bye.